discussions. I think one of the things that sometimes, as I listen to the debate about these bills, is that people forget some of the facts that exist that we're trying to operate in. And one of the facts, as I did a little research before coming here, is that the United States currently stands in debt of $11.7 trillion. That's data that came from the Treasury's website this morning. We also have things called unfunded liabilities, which even though they're calculated over 75 years and they project under the current conditions, whether the promises we've made would outweigh the costs that these programs would incur. Medicare Part A, Part B, Part D all have, I've seen numbers of unfunded liabilities of somewhere between $38 trillion and $100 trillion. That's a tremendous number. When I think about what we're getting ready to do in passing this bill, I have to also agree with the gentleman behind me. I think we need to take pause. We need to think about the things that we put in place with Medicare Part A, B, D, make those the best programs, make adjustments to those, and not I've tried to read this bill that's 1,017 pages. The language in it, I'm a professional that deals with contracts on a regular basis. This is not a bill that's easy to understand, and I think it's open to a lot of interpretations. I think at this point the best thing to do would be to take this bill and take the best qualities out of this bill and look at those things we can do in the existing things that we've already given the Congress and the Senate authority to do and make them better. Fix them before we add to this unfunded liability. What say you about that, Congressman?
Getting to your first point, I'm never afraid of the facts. It's out. The facts never scare me. What scares me is interpretations placed on facts that sometimes get very confusing and far from reality. So let's talk about the issue of unfunded liabilities. You are absolutely correct. The way they calculate unfunded liabilities is look at the total pool of people who could someday be drawing on Medicare, and that's everybody in this room. That's everybody in this room, and it means it doesn't mean that next year there's going to be $32 trillion worth of Medicare spending. It means over the life of that program, that's what the payouts will be expected based on current estimates of life expectancy, population change, and current assumptions about how Medicare works. So one of the big challenges we face is that Medicare has been actually on more unstable footing financially than Social Security. And we had a lot of discussion in the 2004 election and the aftermath about Social Security stability, but Medicare is a really significant problem, and you're absolutely right. We have to do a lot better job of shoring up Medicare, and one of the ways we can do that, quite frankly, is by eliminating some of the waste for overtreatment in the system and making it operate much more efficiently than it does right now. I'll be the first to tell you that. On your point about the length and readability of this bill, I have been on a personal crusade since I went to Washington to get the government to write its documents in plain language so that the intended users of that language know what's in there. But you got to understand, my dilemma is I'm fighting a culture in Washington that rewards people who come from Ivy League universities and want to show how smart they are by writing in language that's hard to understand. Okay? So this happens to be a big disagreement between me and the president, because I think there's brilliant people out here in the heartland who can write the same bill in a third of the space and actually make it a much better bill. So here's the irony. I've got language in this bill to require these insurance policies to be written in plain language. So that's in the bill, but the bill itself is very confusing and difficult to read. So I get that. I understand that. But part of the problem is people don't understand how difficult change is. You know, one of the things I did was I was locked in a room with the chairman of the Ways and Means Committee from New York, the chairman of the Energy and Commerce Committee from California, and the chairman of the Education and Labor Committee from California, and other members of my caucus, the Democratic caucus, who don't want to change the inefficiencies in Medicare because they'll have to go to their providers and say, guess what? You've been getting overpaid and the results you're getting are crap. That's a pretty blunt thing to have to tell people in your district. And if you look at the map right now, there's 5 of us from Iowa. We're going to lose another member probably in 2012. Our power keeps shrinking, and the larger states and the larger cities keeps growing. And the remarkable thing is we came out of that room with language in the bill to fix that problem and to require the Institutes of Medicine to come back with recommendations that the Secretary has to incorporate to change the way Medicare is paid. Now, if you talk to most providers in Iowa, they are flabbergasted that we were able to get that done. But I think that if you look at what a huge portion that healthcare plays in our economy, and you look at where we were at the beginning of this year with the recession, I don't think that we can afford to wait longer to address how healthcare is provided.